All right, November is National Diabetes Awareness Month, and here to tell us more about this condition is Nicole Gross. We're so glad you could be with us today.
Thank you for having me.
All dressed out for the American Heart Association.
Always in red.
And we'll talk about that connection in just a moment. But first, let's talk about diabetes and how prevalent it is right here at home in Knox County.
Yes, it's with heart disease and stroke still being like a leading cause of death, diabetes is a leading risk factor to have that increased risk. So it's just when your blood sugar, your blood glucose is uncontrolled, and it's just going to spike things up. So we really are trying to educate, not just in November, but all year long, because it's so important and it's so prevalent here.
That is so true for a number of risk factors. But one thing I wonder about and always ask about is this. What can get a person in to get checked? Are there some symptoms they really need to look out for?
Yeah, so sometimes you don't have the signs or symptoms. So it is important to get to the doctor or find a free screening. There's a lot going on in the community now, but you could have increased thirst, you could have fatigue, you could have wounds that are not healing quickly, you could also go to the bathroom a lot more frequently. So those are just few things, but again, some people just don't have the signs or symptoms.
And get those regular checkups too.
It is important that we go to the doctor.
Important.
Yes.
Okay, let's talk about the difference, because some people are confused about this between type 1 and type 2 diabetes.
Yeah, so type 1 is genetic and it typically is lifelong. And so the type 2 is where we really do connect it back to heart disease and the increased risk for heart attack and stroke. And so that is preventable. There's so much that's the hard work though. It's lifestyle modification. It's not smoking. It's watching not just your blood sugar, but your blood pressure, making sure you're moving and finding that access to healthy food. We like to say eat the rainbow in fruits and veggies.
Keep that plate brightly colored. And you said there are ways to prevent type 2. You can actually reverse it as well.
You can, all those lifestyle modifications. In addition, if you do need medication, but pairing this up with your healthcare team is really important. But there's a lot we're trying to do in the community to keep the education, the awareness, and have more access to things that are easy to obtain, like the parks that we go to. Having some consistent movement in our day is really important too.
Just a little bit every day.
A little bit goes a long way.
And then work your way up.
Yeah.
Let's talk, before I let you go, let's talk about how diabetes relates to heart disease. Everything's connected.
It is all connected. So there's 2 times the risk of having a stroke or a heart attack if you have diabetes, even if it's not controlled. So that alone is enough to hopefully give some encouragement to get people off the couch, not sitting as often, because if you are a smoker or you have high blood pressure and diabetes or excess weight, it's just time to make some changes. And now is the time to do it when we know we're entering the holiday season, just to shift the mindset, do a little bit of the hard work and do it consistently, and hopefully you can start seeing some changes.
And if you think about it, just be good to yourself.
Yeah, we have to take care of ourselves. Our health is all we've got, and if we want to be around for long, healthier lives, we've got to start making these changes. It's not just the adults, it's our kids. They're starting to get prediabetes so much sooner, and that's where we really want to make the change.
Yeah, early on.
Early
all right.
on.
Nicole, thank you so much for being with us. Great information. We appreciate it.